In Chapter 7 of Laura's story, Laura and Dr. Kreder discuss the strengths of Canada's healthcare system in producing positive outcomes for patients and where there are areas for improvement.
You learn that you can't share everything because people can't handle it, even though it's happening to you. So I had to learn how to navigate that, and it felt really kind of like a relief to be able to really talk to somebody that wasn't a therapist or a doctor, who literally was my age and understood what I was going through.
So, Hans, when you listen to what Laura just spoke about in terms of the importance of the people around her, and you think about it in the the clinical sense, in terms of what the system can provide, do you see any gaps? Do you see any areas, knowing that so much of the recovery comes after the operating room? Do you see any areas that should be strengthened, or should be, let's call them focus points, for people who have the resources and the decision-making authority to contribute to recovery of recovery and care?
Oh, sure. We call it a healthcare system, but it's not really a system. It's individual little silos, and it's very, very easy for a patient to leave the hospital, bones are fixed, check, and to fall off the radar of the healthcare system, because there really isn't a system after they leave. And even in the hospital, I think we need to build better teams, even in the hospital. And I don't know if you recall, Laura, but it stuck with me because I, many years later, became chief and was able to implement some of the things. But you had made some good suggestions about how the team on the ward might be improved. You were up on the ward and you were a young girl, and you confided in me at the time, said, look, my experience could have been better if, and there were a number of things that you recommended and suggested, and over the years we've implemented that. But I think building teams takes effort. It can happen organically, but the healthcare team in the hospital should be linked to a healthcare team outside. Family doctors in Ontario, at any rate, we're struggling to find family doctors for everybody. My wife's a family doctor, and it's very, very difficult for them to manage the volume of patients that are required. So, if you have a patient who's vulnerable, who's on the cusp, who could go either way, become a drug addict, God forbid, or with the appropriate support, make it, and they don't have a good family doctor or a good health team of physiotherapists of outside the hospital, then the chances are less likely that they will succeed, and some people will go down the path that we don't want them to.
Right.
And so the integration of teams across the healthcare experience is something we really need to do a much better job of. And that, functions fairly well early on, so Dr. McKenzie saw Laura, her care was moved to, specialized center like Sunnybrook. Not that Dr. McKenzie couldn't do what I did, but it was just the environment here with the resources we have at the specialized centers is different than the resources available to the community surgeons. And that's great. That funneling, that triage happens fairly well for trauma patients early on. But it's the after hospital care and maybe even the in-hospital care team that needs to be improved. And people are working on that. I mean, there are connections being formed between academic centers and community centers, but the family doctor component of it is really, it's variable. It's quite variable. And what a patient should expect is that regardless of where they live, regardless of what their postal code is, that they would get the same care as somebody in a different postal code.
Ortholink connects the work of the Canadian Orthopedic Foundation to those we serve. To learn more about how your support is impacting lives, go to movepainfree.org. That's movepainfree.org.